The historical nature of fibromyalgia is that we usually see it more commonly in women, more commonly when you have had other stressful events, childhood events that have caused increased stress, certain PTSD disorders, depression, anxiety. So there's a lot of neuropsychiatric conditions that will trigger the onset of fibromyalgia. Also, people with repeated injuries to the same site of the body or the muscle, people with car accidents or pretty major injuries, they can develop fibromyalgia. There is no absolute known cause for fibromyalgia, but the thought process is that the brain gets all these signals from nerve endings and pain sites repeatedly, and it remembers this pain, and it overreacts and hyperreacts, which causes intense flares of pain on a periodic basis. And it's a long-term chronic condition, unfortunately, that can change your quality of life. So we have seen a high increase in the diagnosis of fibromyalgia. The reason for that is not because it's becoming more prevalent, but we're becoming more cognizant of the symptoms and how to treat it. Fibromyalgia is a condition where there is significant, intense, widespread pain all over the body, both joints and muscle, along with fatigue, sometimes associated with what we call brain fog or cognitive changes. The diagnosis of fibromyalgia is usually made only after, and should only be made after we've ruled out other causes. The most important other causes are things like rheumatoid arthritis, lupus, all of these autoimmune disorders that mimic or have the same symptoms as fibromyalgia, sleep apnea, all of these. Once we do lab tests, we rule out thyroid disorders, we rule out autoimmune disorders, then we can say it's fibromyalgia more because of a diagnosis of exclusion. There's also some scales that we follow in order to diagnose fibromyalgia. This is called the Widespread Pain Index, WPI, where the exam involves us pressing on multiple trigger points on the body, and the pain has to be both above and below the waist, and it should be on both sides of the body. And when you hit a certain number, like 9 or out of the 20 trigger points, and it's positive pain that we can elicit, and the severity of your symptoms, then we say, yes, you probably have fibromyalgia. Can fibromyalgia exist with other conditions? Absolutely. It actually may also increase your risk. There's some research that says fibromyalgia patients have increased risk of other autoimmune disorders such as lupus and rheumatoid arthritis or ankylosing spondylitis. The biggest concern with fibromyalgia is how it changes your quality of life. Because of the intense pain and that you have in multiple joints, it can be less functional, can be misunderstood. That increases stress. And it's also a vicious cycle. The more stress you have because of the pain, the more pain you end up with. And it also causes decreased activity, increases depression, it causes other medical conditions because you become sedentary, it increases your risk of having hypertension, increases your risk of having diabetes. So given that, our goal when we try to diagnose and treat fibromyalgia is more towards improving quality of life. How do we do that? Well, there are modalities. Yes, there is a lot of pain, but we always tell patients, initially, yes, there is pain, but it improves because you're restructuring and rewiring the brain to think and to get used to a certain level of pain and kind of breaking through that. So you're doing cognitive behavioral therapy, dealing with the pain by yourself, trying to do activities that will improve your quality of life. And then aerobic activities, aqua therapy. You're also trying to treat the anxiety and the depression. So multiple modalities, it's a team effort. There's a lot of medications that can be used for fibromyalgia. The biggest complication during treatment of fibromyalgia with medications is to start relying on long-term pain medications, especially opiate pain medications, which research has shown that the more you use opiate pain medications, or even naproxen, ibuprofen, all these NSAIDs, there's actually rebound increase in pain. And so hence this becomes a vicious cycle. So we have to be very careful when we give pain medications. The mainstay and where we've found the most benefit is to try to control the pain through both, as well as anxiety, depression, but neuromodulation with medications called SSRIs and SNRIs. The SSRIs are such as Lexapro. We use, Zoloft, Prozac. These also help with anxiety, depression. And then we also have the SNRIs such as Cymbalta, or duloxetine, which is used a lot primarily now for pain control, long-term pain management. These medications have been definitely shown to help. There are some medications that we use that are for neuralgia, neuropathy, and these are also mild anticonvulsants. You've probably heard about Lyrica, which is pregabalin, and gabapentin, which is Neurontin. In research so far has actually shown that gabapentin and Neurontin and Lyrica have much longer lasting impact on pain control. And when combined with SSRIs, and rather than using opiates or NSAIDs, these medications have shown to really improve both the fatigue as well as the widespread pain. Other modalities that we can use, of course, the biggest thing is sleep. Regular sleep, proper sleep, hydration, lifestyle management, cutting down alcohol, cutting down caffeine, stop smoking. These are play a very big factor in controlling fibromyalgia symptoms. And a lot of times, it's very frustrating because the pain is so variable and you have so many different flares, and you don't find to accept that you have fibromyalgia without a known method of fully treating it and resolving it can be very frustrating. And so hence, there's a lot of people who go from doctor to doctor trying to find, and multiple tests done, multiple ER visits, and sometimes being prescribed chronic opiates, which in fact does more harm than good. So the best thing is for us as physicians and as healthcare providers is to reassure patients and to kind of form a team to help them, sending them to a dietitian, talking about, anxiety, depression, therapy, both physical, occupational, psychotherapy, getting a psychiatrist on board, and also to make sure that our patients understand that this is fibromyalgia at one point used to be thought as a psychiatric disease. No, it's not. It is an actual problem. It is an actual disease just like any other, hypertension, diabetes, any other. And we have to kind of understand that and treat it as such, and to get the best outcome.